The journey of a heart transplant begins at the edge of life. For a patient with end-stage heart failure, the muscle that sustains them has grown weak, enlarged, and died. It can no longer pump enough blood to meet the body's needs, turning every breath into struggle. But then a glimmer of hope arrives. A healthy donor heart, a gift of life, is transported with extreme care, preserved in a sterile, cold environment. This vibrant organ is a key of second chance. Time is the essence, every second counts. The procedure begins in a highly controlled surgical theater. The surgeon performs a median sternotomy, carefully opening the chest cavity to gain access to the failing heart. It is a moment of absolute precision, marking the start of a life-saving transformation. To perform the transplant, the patient's circulation must be maintained while the heart is still. Surgeons connect the patient to a heart-lung bypass machine. This advanced technology takes over the role of the heart and lungs, oxygenating the blood and keeping the vital organs alive during the surgery. With the bypass machine active, the main aorta is cross-clamped. This stops the blood flow to the heart, allowing it to go still. In this quiet moment, the surgical team prepares for the most critical phase of the operation. The surgeon now carefully removes the diseased heart. The major vessels are divided, leaving behind only the back walls of the arteria. This empty space, once occupied by a failing organ, is now ready to receive a new engine of life. The donor heart is gently lowered in the chest cavity. It is healthy tissue and perfect structure stand in stark contrast to what was there before. The alignment must be perfect as the team begins the delicate task of reconstruction. Now the intricate work of anastomosis begins, using structures finer than a human hair. The surgeons connect the left and right artery of the new heart to the patient's remaining tissue. This creates a seamless biological bridge between the donor and the recipient. Next, the major plumbing is restored. The pulmonary artery and the aorta are meticulously staged together. These connections must be incredibly strong and leak proof to withstand the high pressure of a beating heart. The moment of the truth arrives, the clamps are released and warm oxygen rich blood rushes into the new heart for the first time. As the tissues returns from pale to a healthy pink, the organ begins to wake up from its cold slumber. And then it happens, a single contraction followed by another. The new heart begins to beat with strength and rhythm. This powerful first beat signifies a successful transplant, a miracle of modern medicine and the beginning of a brand new life.